morning, everybody. I'm Igor Volovich, CEO and founder of RoadDoc. We are building a decentralized healthcare access ecosystem, specifically targeting at the truck driver community. We are targeting the TAM of $5 billion a year. These are folks who are always on the road. They don't have access to healthcare, and so what we're doing is bridging that last mile access problem for healthcare. Why truck drivers? Well, for one, they're severely underserved. It's a major population that's out there that does not really have access to healthcare on a consistent basis. There is no care continuity. A lot of them face a lot of chronic conditions, and of course those are as a result of their lifestyle and the fact that they don't have consistent access to healthcare. 70% are obese, 54% smoke. That leads to a lot of chronic conditions, of course, and by the time they show up to a physician once every couple of years, which they have to do for their DOT mandatory physical, typically these conditions are already far advanced to be treated. So as much as possible, we're trying to lean towards preventive care. And of course, these are issues that are identified by the DOT, the CDC, NIH, and the industry associations. They realize that their population is growing older. Average age is 45.8 years old. And we know that health outcomes are very poor. And in fact, the average life expectancy for a truck driver is 16 years under the average national of 77 years old. Another data point is the fact that 1 in 4 veterans is actually a truck driver. And there are reasons for that, because you can actually get a CDL, commercial driver's license, without going through truck school if you are actually in the military, driving anything really. And it's getting even easier to get those CDLs. So a lot of veterans wind up being truckers. And then the problem is, of course, accessing those VA benefits when you're on the road is also very difficult. It impacts, of course, beyond just the truck driver health. There's also economic impacts, and of course, the trucking companies are keenly aware of this. Unplanned truck downtime is, costing them up to $1,000 a day, and sometimes more. Revenue impact, cost impact, etc. The time to recruit and retrain those drivers, of course, because of the churn of 94%, that's a significant number. 94% actually change their employment. The benefits don't follow. And the ability to access care, of course, is further impacted by their inability to transfer those benefits job to job. A lot of them don't have benefits to begin with. So again, multiple impact points. And of course, on a global scale, economic scale, national scale, this definitely has a lot of impact. Our offering is an autonomous health pod. What we're talking about there is really the ability to transport health to the truckers instead of having truckers transport themselves to the health access point. We're building containers. Really, they're 20-foot ISO containers. They're retrofitted with medical technology. All their technology already exists, so this is really more of an integration effort as opposed to an R&D and engineering effort. We're working with a lot of partners, and really the objective is to deliver 24/7, 365 access to care on an autonomous basis, and really a watering hole model. We go to where the truckers are as opposed to trying to bring them to us. Autonomous because we want to reduce the overhead. The typical ways that folks have tried to serve this community is by building actual clinics at truck stops. There's only been 3 built so far in the nation, so clearly the model has not proven itself out. We're not trying to hire a lot of doctors. The objective is to actually extend existing practices to this community and bring the patients into the existing telehealth models. Out of 10 million CDLs issued, 4.1 million are on the road every single day. There are thousands of commercial truck driving companies. There are plenty of truck stops out there who want to partner with us. And so being able to offer this on a subscription basis offers us the ability to access the market pretty directly and easily. The business model is B2B2B. We're offering the providers an ability to extend their practice and access the patient community that they currently are unable to access. For the commercial carriers, it's a way to mitigate their healthcare risk. Of course, they understand that this has significant economic impact to their operations, and so reducing that to the degree possible is definitely within their the line of sight. We are pursuing a subscription-based model, so we're looking at ARPU of about $1,200 a year per patient. This can be funded by the truck companies. They can be funded directly by the truck drivers themselves. It is accessible. It is a concierge care model that these patients are not even aware of, and they're able to access that at a pretty significant discount on a consistent basis. We're looking at about 5 encounters per year, which is a little slightly above the national average of 3.2. And still, it's a very profitable model. We're looking at about a 5x gross profit on the gross margin on those things. Financial projections, we're looking at $3 million raised, gets us to about 12 months. First prototype, and then we get to be in the field with about 5 locations. Some folks have tried this before. As I mentioned, one of them tried to build clinics. Forward is one of the major ones, $325 million raised to date. They built 19 clinics and trying to build an AI doctor. That's not what we're trying to do. We've got validation and support. American Legion is definitely behind us. They want to give us access to this community, And we're pushing towards non-dilutive funding as well. We've circled about 600K in revenue so far. Our team, partners, like I said, 90% of this exists. This is simply an integration effort and then pushing it out to the market. Come talk to us. Thank you.